Public health has never been India's strength. But if you think things are bad in mainland India, wait till you visit Mizoram. Over the past few years, we have done several important stories that highlight the precarious situation of public health in Mizoram. It is true that COVID-19 stretched India's public health to its extremes. But in some states, that was the situation much before the pandemic. Take Nagaland and Mizoram for example. Both states with some of the weakest public health systems in the country recently came top in one category they wouldn't ideally want anything to do with. The percentage or rate of HIV/AIDS prevalence in Mizoram is 10 times higher than that of the national average, second only to Nagaland. Mizoram now has the dubious distinction of being the highest HIV/AIDS prevalent state in the country with over 2.30% of its total 10.91 lakh population, according to the 2011 census, being infected. However, at least in the case of Mizoram, it is not as if the government or the residents have only now realized the true scale of HIV/AIDS in the state. The state has been actively battling the public health crisis for decades, but clearly, more needs to be done. So what should the government do now? What else do the NGOs and public health experts recommend? Where is the gap and is there light at the end of this tunnel? I am Kalyan Deb, and in this week's episode of Decoded, we look at how Mizoram became India's AIDS capital. Pursuing for months.
Rural village of Assam.
In the 75th Independence Day,
(1992). India has just dipped its toe into the modern world and will soon see the launch of cable TV, the return of Pepsi, and all things liberalization and globalization. However, with all this came the somber news. On May 27, 1992, India marked the death of Dominic D'Souza from AIDS-related causes, the first person in India to have become infected with HIV. 2 years before, the young state of Mizoram had recorded the first case of HIV, and since then, it has lost over 3,500 people to this deadly disease. In comparison, the global pandemic has, until August 26, killed less than 800 people. Now yes, we are aware that one cannot compare 3,500 deaths over 3 decades to 800 deaths, most of which were in just 1 year, 2021. Our point is that Mizoram has been battling COVID ever since its inception, and it seems that going by the current numbers, the battle will continue in the near future. Worryingly, for Mizoram, the State AIDS Control Society or MSACS project director Dr. Lal Tlengliani said the percentage of HIV/AIDS incidence in the state is 10 times higher than that of the national average. Equally worrying is the fact that most patients are in the 25 to 34 age category, which means that people who are supposed to be in their prime health are the biggest victims. We spoke with Living Hope Ministry, one of the NGOs engaged in the Targeted Intervention Program under the MSACS. They conduct syringe exchange programs, mentoring and counseling for injecting drug users, and conducting blood tests every 6 months. They give positive patients counseling and help them get access to their medicine and other needs. This is what Rosalind C. Venlal Ruati, who has worked in the NGO for over 7 years, had to say.
Six months, 6 at a car, and now the IDU can take on 6 at a car in the syringe in Mantroma Kai, the condition line, 6 at the hand, Kai, how many Ezute more Mizo Ezu, may make a hundred of one, can summer, you can't 60, you can't talk my to lie, I don't talk my can lie. Hey, anh thì bul cuối biển nhìn cái啥,ท่านสุกันเกี่ยมานี่นะกันหันหัวเวทีสินะช่วงกันเน่าเตียบกันหันโซ่เฮียนกันเน่าเตียงเงี้ยพอเซ็กซ์จังอะไรท่านเห็นต่างแม่ไม่อะทุกวันช่วงนี้ Hai tianga kan in siam cha ni lo chon te kan pun lam hi kan pan je lang ti ka rin da na ni boka IDU ai ma he ne syringe in man trom ti vel ai ma hian sex atanga kai hi kan tam me ma tun lai a chon kan rin lo pui he nan lo kai to mai si mo chu bang chon he hi chu na san ku kan a be tha ka tia kan sim inge sex te po he ega tan ma ngai lo ang lo wit ke ma kan in zir tir na sex education hi mo hi kan in zir tir na sa te po ngai ka ti.
Importantly, Venlal Ruati said one crucial thing. The government, including the central government, is working hard in the fight against HIV/AIDS. She also mentioned that antiretroviral, commonly known as ART medicines, which is used for the treatment of HIV, are distributed for free.
ART la to ho sa po hi hey te to pin chwa ani hey ai lak eng tin nge man lak o ti chu soi ngi na ke chu a feel da ka kal chin da sai te voi na ma te po ART te kal reng bai kan ni ta te nga mi bot pu na sai ni a thil chi sang sang an the ang hi chu an ti ve ni mo ti khanin hey ai chon eng tin nge man lak o ti chu han soi mai chu har sa ka ti a tu dan malak na po hi a central sarkar ang theng pon a tha ka te a chu ART dam doi te po ni se sang tam tak man hi man lowin an pe a ti chuan viral load mo viral load kan tia tak sa chunga virus om sa shet theina khang te po ti khanin man cheng sing don sen na turam teng te po ti khan man lowin an rot ti sak to a.
Apart from NGOs, the church has been at the forefront of this war against HIV/AIDS. And by that, we do not mean issuing a religious decree against those suffering. On the contrary, one could very well argue that Mizoram's numbers would have been far worse without the crucial intervention of the church. Here is what Lal Lilauma, Secretary of Mizoram Kohran Ruaitu Committee, a conglomeration of major churches in the state, had to say.
The church has the best public platforms for educating the people against the spread of HIV/AIDS because they have all the churches are having pulpit where they have a good audience and spectators. So I think the church can do a lot in preventing this HIV/AIDS by promoting and advocating this program in their respective forums.
In Mizoram, it is clear that all stakeholders and activists are not only aware of the problem, but they are also working day and night to tackle the problems head on. However, clearly the system is not working efficiently enough to reflect in the data. We also spoke to the Mizoram AIDS Control Society, but most of the answers were vague or shed little light on what the government plans to do differently. Simply saying, we are increasing awareness is not enough. Worryingly, their best efforts have not been enough. The question is, what next for Mizoram?
Don't forget to like, share and subscribe to EastMojo. For any queries, put them down in the comments section below and press on the bell icon for notifications.